Hello, everyone, and welcome. I'll start with an acknowledgement of country and our First Nations peoples. Now, today we have two presentations, and our topic area is community engagement in emergency and disaster preparedness. So they're beautifully matched. Now, our first presentation is from Dr. Barbara Ryan, University of Southern Queensland. And then our second presentation is going to be led by Kate Delmo, University of Technology, Sydney. She's leading that presentation. The second one we'll hear this afternoon. And she's going to be joined by Melinda McDonald and Natalie Krakoa. And what I'm going to do is introduce Barbara Ryan and her topic, and then we'll move on to the second, and we'll see how that goes. We might have questions at the end of both sessions, perhaps, but you're welcome to put them in the chat. We can see them then, and ask them. So a big welcome to Dr. Barbara Ryan. Barbara is a disaster behaviour researcher who specialises in natural hazard community engagement for preparedness and disaster response communication. She teaches disaster communication and community engagement and emergency management, as well as a range of public relations courses. I know this to be absolutely true because I teach public relations with Barbara. She's currently working on a co-design project with community engagement volunteers and Queensland State Emergency Services, developing a training package that will enable them to galvanise their communities for readiness at the onset of extreme weather. So we have a rundown of Barb's presentation. I think she's the best person to speak to it. I might just try and pull out a couple of sentences from that. So emergency agency volunteers from rural fire services and state emergency services are the frontline motivators in their local community to get people to prepare for disasters. So, I mean, you read into that there's a lot that's involved, besides being at the fire front. However, they have very little training, and their community engagement approach has been restricted to educating and informing. And you know, it's come to light that this is not as good as it could be, or sufficient enough in terms of motivating preparedness activity, which is the purpose behind the kind of research that Barb's putting together. And her work and research is being used to develop training resources. So I'll hand over. Welcome, Barbara.
Thanks very much, Chris. I'll just share my screen. Hopefully you can all see that. So today I'm going to talk to you about a project that I'm working on for State Emergency Service in developing the capacity of volunteers to really undertake meaningful community engagement and to choose the right techniques for the different types of communities that they need to work with to get ready for extreme weather season, which is usually around November to April each year. So the objective of this is to develop a whole training package. Initially, in the old days before sort of this new initiative came in, the volunteers would do a one-day workshop on community engagement, a lot of which was around emergency management doctrine and all of the policies and procedures around that, not much about how they would do community engagement, what it should look like, and also how they can they make it effective. So they were sort of sent out into the world to do their own thing and to often to reinvent the wheel. So hopefully this project will help them develop a more effective way of engaging with their communities. One of the side benefits we hope of it will be added recruitment as well. So I'm working with probably from a base of 5,500 volunteers. We have about 150 community engagement specialists in the volunteer base. Each one of those belongs to what we call a group, which is a very small locality within one of the 7 regions across Queensland. The interest in community engagement in the SES is really growing, and it's really important because that local approach is really what we need when traditionally the capacity for behaviour change in terms of getting ready for storms has been left to the mass media campaign, public relations campaign point of view. So if we can blend the two together, have a state level campaign and then have that reinforced by local level activity, then we're pretty confident the SES can really start getting some runs on the board in terms of getting people ready for storm, cyclone and floods. It's all aimed, as Chris said in the introduction, the way the SES works at the moment is very much go to a market or a show, go to Bunnings, set up a stall and hopefully make eye contact with people, and then those people will come over and have a chat with them. So, and then sort of work out exactly where they are in terms of their preparedness, usually not that far advanced, and then motivate them then to get ready for storm, cyclone or flood. And one of the big things we know in research in this area is that people won't actually take any sort of action at all until they understand what their risk is. And usually that that risk is communicated to them in the form of visual materials like council flood maps and so forth. Oops, sorry. So where all this started was actually with a research project that I did with Professor Maureen Taylor from the University of Technology, Sydney, and Professor Kim Johnston from QUT. Back in 2018, 2019, we did a research project that mapped how agencies across Australia did community engagement. We talked to every agency except for South Australian SES. They were going through some staff changes at that point and couldn't participate. But all of the agencies took part, and we were able to map not only how they did community engagement, but also what they aspired to in terms of community engagement. And we looked at the frameworks that they were using as well. Very driven by frameworks in this sector, probably as much as the community engagement sector in general. So what we came up with was a model, a framework that actually was built specifically for the individual needs of the emergency management sector. So it actually became a model that could be used with volunteers, because in the emergency management sector, most of the community engagement is done at volunteer level in that small locality level. So with fire brigades and SES groups. And it's that local knowledge that really gives our volunteers the edge. But they need the skills to really understand how they can capitalise on that local knowledge and that trust that they already have in the local community. So we developed this sort of a stepped model, but you know, it's really an approach to working out exactly how involved our communities are in terms of understanding risk, how involved they are with the messaging that we're putting out, in terms of getting ready, and that type of thing, and their investment. So at the bottom of the pile, we know that there are groups within our community that reflect different approaches to emergency management and also understanding of risk. So we have at the very bottom of the list are the people who are oblivious to risk or who are actively denying that they'd ever be affected by any sort of natural hazard. And so what we've got to do is with the oblivious people is to start a relationship. So we've really got to understand what those communities look like, what subgroups there are in those communities, people with a disability, people who don't speak English as a first language, Indigenous communities, elderly, children, single mums, all of those subgroups that have really different perspectives towards towards getting ready for disaster, and also different capacities in terms of fitting it into their calendar or being able to afford to take protective action, that type of thing. So that community profiling is something that the volunteers don't tend to do. They usually tend to wing it based on their gut feel of what the community looks like, and they usually try to go for the general public approach. So that's everyone, rather than identifying who the particularly vulnerable groups are and then working with them. And even if they did identify those vulnerable groups, quite often they're quite aware of who their vulnerable groups are, but they really don't know where to start because those vulnerable groups don't turn up at the local show, or they don't go to Bunnings to get a sausage and have a chat. So how do they start those conversations? So the model goes through these different levels of involvement. So the relational ties is where we start with the people who are oblivious. Once the people start to get really interested, they understand their risk, then they start to get interested in what they can do to keep themselves safer. Then we can move into capacity building. Then we work through to more of a community-led into those groups where people are so passionate about this that they're dragging other people with them, and those community programs level is where that occurs. And all of this really needs guidance for the volunteers on what community engagement activities you can use that will be effective with each of these levels. So for instance, we wouldn't do a risk mapping workshop with a community that's completely oblivious to their risk, because nobody would turn up because they don't really understand the need for that. Whereas, with the community-led group, a risk mapping workshop would go off really well. It would attract a lot of people, there'd be a lot of conversations, and then there'd be action after that. So one of the challenges that we found in our research was, how do we put together a toolkit that volunteers could then use quite simply to then plan community engagement for their particular areas. And the last step is the local hazard action, and this is how the group or the brigade interact with the different groups within their community that they've already had relationships with. So the way we're doing this program is we're trying to build on the old model of the one-day workshop, which was built really for fire and then sort of plugged SES in. And SES is really the lead agency in terms of responding to flood, storms and cyclones. We're trying to make this very much bringing along what already worked well and discarding the things that didn't work so well. So that meant that we needed to do a co-design process. So we went into this starting in March, getting the volunteers to tell us all about what they were doing, what worked well, what they found didn't work, what they needed in terms of training, and all of that type of thing. And I also mapped who was doing what very well. So then I had some gurus in, school programs or round robin workshops or mapping or that type of thing. So I've got a list of specialists around the state that can really become mentors and champions in those particular techniques. So we conducted 6 weeks of interviews and focus groups with the volunteers. We involved about 80 of them, which is pretty good considering we think we've only got 150 volunteer community educators, which is what they were called in the old regime. They sort of gave me a lot of info and intel on what would work and what wouldn't work. Then they sent me away to come up with a map of courses. And from that map, we were able to work out what was going to work and what wasn't going to work, what types of training we would give to the different levels of volunteers, and also developed a working group of 40 people who are really committed, meeting every fortnight, helping me with the course outlines, what we were going to teach in each course, and then reviewing the written courses as they came through. So this was it sort of emerged as to become a really really involving co-design process. So, you know, I might be the content matter expert in terms of human behaviour, but they're the content matter experts in terms of their own communities, their regions. There was a lot of difference between regions in terms of what worked and what didn't work, and also in terms of the education and inform that they were already doing. So what we found from that research process was critically that the volunteers were super passionate, but they didn't really understand that there was another way of doing community engagement apart from standing at a stall and handing out information. So what we've tried to do with this program is introduce them to the concept of first identifying the target groups and then matching techniques to start the conversations and keep those conversations going. So really what we've got here is a completely new model. It's gone from 1 course to 21 courses, but each of those belongs to a different level. So I probably should have had a diagram here, but I'll just stop sharing for a minute. The courses are in 4 levels. So we found during the research that there's not a great understanding of community engagement and why it's important for SES to be doing community engagement, as well as how it can look. So we found that at some groups, the senior management team who are operational people, so they'll be floodboat operators and chainsaw operators, and you know they plan the emergency response. They're very much response focused. They will not understand what community engagement is and be really reluctant to undertake it. So sometimes it's really hard for our specialists to push through and actually do some meaningful engagement with some strategic planning behind it. So what we decided to do was to introduce a compulsory course for every member that comes in on what community engagement is and how they might be dragged into community engagement just doing their day-to-day response to different incidents as they happen. So a community engagement volunteer will go out on tasks. So it might be tarping a roof or chainsawing, chopping up a tree that's fallen across the road, that type of thing. But in the process of doing that, they will come across people and they'll be able to deliver some community, some preparedness messaging. So, you know, next time when this comes up on BOM, you should do this, this and this, that type of thing. So they really needed to know how to make the most of all of those contacts with the people that they come across in their community, in their day-to-day operations. And it also the idea of doing this compulsory course was that eventually our group leadership will have come through knowing that community engagement is going to be really valuable and will ultimately reduce the number of tasks they're called out on, because people will have prepared their roof and checked their roof, and they'll have emptied their gutters, and they'll have got rid of that branch that's hanging over the road and things like that, that will you know, if we can get people to do all of those things, then the SES group will be called out on fewer tasks during a storm or a cyclone or whatever. So that was the first level. Then there was a level that they were really keen to look into, which was what we call just in time. So this is training for tasks that they get deployed on as community engagement specialists. So it might be a door knock to get people to evacuate, or it could be helping at an evacuation centre, those types of things. So they needed training on really short chunks of training that they could do on the bus on the way to Rockhampton to help with a door knock or whatever. So they're doing door knocks, communication skills, basic rural fire service and other lead agency support, and also understanding trauma, because often they're deployed into post-event scenarios and residents are quite traumatized. They don't, as SES members, they don't need to know how to deal with that. They just need to know how to recognise that and where to point people for help. Then the third level was the community engagement specialist level. So this is where they do a one-day workshop to introduce them to that map that I showed you earlier of the community's involvement and what techniques you can match to each of those levels of involvement. But also things that some of the groups have their own social media pages. So they wanted to know about social media. They wanted to know how to aim their community engagement specifically at recruitment. They wanted to know how to connect with young people, cold communities, the disability, people with a disability. And so from that in community engagement specialist package, we've developed a number of courses that will help them in each of those things. And so you can see that each of those courses is going to be specific to a community. So there might be a community that, you know, like my community, completely Anglo-Saxon, no cold community to really be concerned with and worried about. So I wouldn't do a course like that, but I might do the course on working with people with a disability. Then there was a fourth level, and that was came from comments that the volunteers made about just being sent off to do the course, and then that was it, nothing more. They might be doing community engagement for 10 years, but have no sort of contact or update or any further training. So, and they found that that was quite demotivating, especially when they were working by themselves. And I mentioned earlier that reinventing the wheel too. I found in the research that we did that somebody would think, oh wow, I've heard of so-and-so doing this. That sounds like a really good fit for my community. I want to hold that event too. And then they'd invent the whole thing from scratch, which would take them a lot of time. And also they'd be missing the experience that others had gained. So we've introduced a fourth level, which is around building a community of practice, formalising that community of practice, and making sure that the people who are doing really good things can explain those really great activities to the other people in their sphere. So what we're going to be doing from this point, I'll just see if I can share again, sorry. I think I'm running out of time, so I'll be very, very quick. So the next step then is for us to be testing the training, and that's going to happen in workshop form in a couple of weeks. Then we'll undertake evaluation probably after 12 months. Queensland Reconstruction Authority does regular research on how prepared Queenslanders are, and we'll be able to tap into that research to see if our volunteers are making a difference. Probably the big light bulbs that have come from this process is that when it comes to volunteers, we tend to reduce them to the lowest common denominator in terms of intelligence, and we forget to tell them why they need to do this. So, you know, why are people upset when they answer the door and they are being told to evacuate? It's because they're at different levels of preparedness. They're in different situations in life, different sort of stages in life. They might have just put the dinner on and they've got a screaming baby. Those types of things have really helped the volunteers as we've gone along and we've introduced the human behaviour element into the courses. Also, I've learned that people at local level are hugely skilled and hugely open to development. We tend to, in emergency sector, have had courses that are very, this is the way you do it. And once you've done it, that's it. The human behaviour element of this suite of courses is really difficult to overlook and makes it very difficult from other training that they do. Also, the SES has been a vastly overlooked resource when it comes to community resilience. Not much has been invested in terms of training for SES, and I think they're going to have a huge impact now that that's actually happening. And also that volunteers are incredibly conscious that we're overlooking vulnerable communities, but really unable to take steps to make the contacts that they needed because they really didn't know where to start. Right, that's it from me. So I'm not sure what you want to do about questions, Chris. Do you want to wait till the end? Oh, you're on mute, Chris.
Yeah, sorry, I was on mute, yes. Yeah, I think we will wait till the end. We haven't got anything in the Q&A as yet, so I encourage people to. We will have trouble in squeezing in questions, but we still want them. Now, I've got a couple of points, but I've got them written down. I'm going to wait and to talk to those in terms of your presentation. So, and groups, our presenters may want to ask, our next presenters may want to ask questions of Barb, and Barb might have some questions for the other group as well. So now, excuse me for a moment. Kate Delmo is leading this presentation that we're about to, the team presentation. I'll introduce the other speakers in a moment. And it just occurs to me, it segues quite nicely because I can see that multiculturalism and other languages are a feature when this topic comes up. And that is the focus of Kate and her team's presentation this afternoon. So it's a nicely matched and nicely segued. Just a couple of dot points and introductions to get going on that thing of multicultural and other language. So our overview shows us that in December, the December 2022 census, that 30% of our population here in Australia is born overseas. There's a variety of, well, there's top 5 languages, including Mandarin and Vietnamese, and so on. And that, this is an interesting one, that 2.1 million people speak a language other than English at home. So for these kinds of reasons, gives extra impetus to the importance that emergency and disaster management, that the emergency and disaster management sector be proactive in developing strategies to reduce risks and increase resilience amongst groups like this, and groups who are often more impacted or can be more vulnerable to risk and being prepared. This issue of preparedness. So Kate will share the findings and her team of funded research by the New South Wales Reconstruction Authority, led by Fire and Rescue New South Wales, and University of Technology Sydney, with support from her co-presenters this afternoon, Linda McDonald and Dr. Natalie Krakowa. So Kate researches in crisis, emergency and disaster, resilience, and in the area of digital media influences. She's currently working on a funded project that, one, focuses on cultural competency of emergency responders in engaging with culturally and linguistically diverse communities, and two, spontaneous disaster volunteerism in Australia. Kate teaches in the Bachelor of Communication, Strategic Communication, and the Masters in Strategic Communication programs at the School of Communication at the University of Technology, Sydney. Melinda McDonald is a research officer in the Community Engagement Unit of Fire and Rescue New South Wales. She's an operational firefighter and a communications professional with experience across community safety, emergency and disaster management, education and multicultural issues. And Melinda works with Fire and Rescue New South Wales on community risk reduction, or in the community risk reduction unit rather, to identify gaps and examine current approaches and develop evidence-based programs to reduce risks for culturally diverse communities. Last but not least, our next co-presenter, Dr. Natalie Krakowa, is a media scholar and practice-led researcher at the University of Technology, Sydney also. Natalie holds a Doctor of Creative Arts in Media and Cultural Studies and currently researches and teaches digital media and screenwriting. Natalie's work also focuses on issues around LGBTIQA+ representation in screen studies, popular culture, and transmedia, and the use of digital and social media in disaster risk communication, particularly in improving communication and community engagement using new media technologies. So without further ado, I'll hand over to Kate and the team. Thank you.
Thank you, Chris. Thank you for that introduction. And I think because you have mentioned basically what the study is about, I'll quickly hand over the screen to Min so that we can get started. Thank you. Off to you, Min.
Sure, thank you. So I guess just to put our research in context, I'll start with a story. July last year, 2 children and 4 adults were assisted by firefighters and paramedics and rushed to hospital with carbon monoxide poisoning after bringing a charcoal cooker inside to heat their single-bedroom granny flat. I'm glad to be able to say that in this particular incident, there were no fatalities, but the outcome could have been very different. Later that week, a respected colleague asked me, why would anyone do something so stupid? That question really highlighted a knowledge gap, and it prompted me to consider, are there better questions we can ask? Questions like, why are 6 people living in a 1-bedroom flat? Did the family understand the risk? Did they have the information they needed to keep themselves and their loved ones safe? And those types of questions lead us to something even more significant to consider, and that is, what progress is the emergency management sector making towards culturally competent risk reduction for emergencies and disasters? Next slide, Kate, thank you. Fire and Rescue is one of the largest urban fire services in the world. It's definitely the busiest in Australia. We respond to a really broad range of incidents, including structure fires, rescues, hazardous materials incidents, and more. Over the last 10 years, we've also become increasingly committed to prevention and education as a first line of defence. So that is preventing the worst from happening through evidence-based community risk reduction programs. We still have a long way to go, and unfortunately we're recognising that even with this broader focus on prevention, the current research suggests that fire safety initiatives aimed particularly at culturally and linguistically diverse communities are underwhelming and often inconsistent. And the New South Wales Government's multilingual communications lack a decision-making framework, resulting in inconsistent and non-strategic communications. So our communities report confusing or inconsistent messaging or inaccurate translations. Emergency personnel report feeling restricted by a lack of resources and training, leading them to develop informal and ad hoc solutions. Fire and Rescue recognised that there are some identified gaps in the accuracy and effectiveness of our current public safety communication. That a lack of effective communication may inhibit risk reduction efforts. We recognise that there is scope to build capacity of emergency services through an actionable model for culturally competent communication, something that we recognise is lacking, particularly because we have a heavily male-dominated, Anglo-normative, middle-aged workforce with a very low turnover and very little experience outside of fire services. And we also recognise that many culturally and linguistically diverse community members may be able to contribute innovative solutions to support our communities in becoming more resilient to preventable emergencies and disaster situations. So, as Chris mentioned, the most recent Australian census reports that in New South Wales, our largest state, 1 in 3 residents were born overseas, 1 in 2 have at least one parent who was born overseas, and 1 in 4 people speak a language other than English at home. There are now more than 300 languages being spoken in New South Wales alone. What the census data doesn't tell us, though, is how our changing communities are impacted by risk. And one of the first things that we've discovered is that just being culturally diverse does not necessarily put you at higher risk. Culturally and linguistically diverse people are not an object to be acted on. They're not a homogenous group. They're individuals with differing levels of risk and need. So a recent fire and rescue report on adverse fire outcomes revealed the limitations of our own data that's collected in incident reporting systems and suggests that current findings on the impact of culture and cultural practices in fires is still ambiguous and sometimes conflicting. So more research is needed to identify at-risk components of cultural diversity and how these interact with other risk factors such as socioeconomic disadvantage, low English proficiency, being aged, or perhaps living with a disability. This joint research initiative of Fire and Rescue New South Wales and the University of Technology Sydney is designed to address that gap. And I've been very grateful for the expertise and experience of Kate and Natalie in bringing these thoughts together. Our goal is to support greater cultural competence on the part of emergency responders and to develop evidence-based approaches to prevention, intervention and response for our culturally diverse community. I'll hand back over to you, Kate.
Thank you, Min. So as Min mentioned a while ago, our research is underpinned by 2 major conceptual frameworks. One is the notion of cultural competency, and we are using Kapin Habakkuk's process model of cultural competence. This model basically talks about the importance of understanding cultural norms, beliefs, practices of diverse groups. Now, we are focusing on CALD communities here in New South Wales and hopefully within the scope of Australian response recovery practices. This model of cultural competence has been widely applied in public health and nursing, but not in emergency and disaster preparedness. So we think that there is a gap there that we can also contribute from this perspective. Now, more importantly, one of the premises of our study is that cultural competence needs to be approached holistically. We need to be able to look at it from a perspective of before emergencies or disasters occur, during, and even after. So given this, the Australian Disaster Resilience Policy Landscape Model is one model that we're looking at, mainly because we're focusing on prevention and preparedness. And we are thinking that the intervention of technology in emergency preparedness can be very much be applicable to the various stages. But for this particular research, we're focusing on the first 2 stages, which would be preventing and preparing emergencies and disasters from the perspective of community members. So there are 2 main research questions that we are addressing in this project. For phase 1, we are addressing the question, what factors contribute to the cultural competence of emergency responders in engaging with members of CALD communities? And for phase 2, how can we best design a mobile app to help CALD communities prepare for emergencies? So for our methods for phase 1, we've had a mix of qualitative research methods. We've conducted focus group discussions with 4 CALD community groups: the Arab-speaking group, Chinese-speaking, Vietnamese-speaking, and the Kurmanji or Yazidi community in Armidale, New South Wales. We've also complemented that with interviews with firefighters from city and regional stations. And we've also conducted a survey among newly arrived migrants. Now, we're quite happy with the help of TAFE and Navitas colleges in trying to come up with ways on how we can penetrate into the communities. And of course, Min's team and the Community Engagement Unit of Fire and Rescue New South Wales, because without them, we won't be able to get in touch with the adult learning migration programs that are quite critical to studies such as this. So quickly, what are the findings? So some snapshot findings from our research, from our survey research would tell us that the people that we have surveyed are predominantly women aged 30 to 39. They exhibit high degree of intergenerational living, so quite extended families in dwelling places. So 77% of them live with children, and most of them also would live with parents. They have high mobile phone literacy, all use smartphones and apps, and they have language needs, meaning to say 72% need some degree of help in English translation. So what are their sources of information? We have seen that their most common sources of information would be from schools, colleges, and universities, personal networks such as school groups, play dates, and family members, and a mix of old and new media. Now, this is important because we understand their level of proficiency as well in terms of getting information about fire safety. So in terms of fire safety knowledge, we have learned that most of our respondents are aware of home fire safety equipment, but they are not familiar, or they have low familiarity with Fire and Rescue New South Wales as a government agency. And when it comes to their familiarity with Fire and Rescue New South Wales campaigns, there is basically no or limited familiarity with some of those campaigns, such as the safety home visits, the Get Down Low, Go, Go, Go fire safety campaign, and also the Stop, Drop, Roll campaign. So we can see basically from this that there is a gap there in terms of how we can perhaps raise awareness in terms of how community members can prepare for fire safety and can be more prepared with fire emergencies in their households. Now, when we were analyzing the interviews and the focus group discussion data, we have realized that there are many things that we take for granted. So, for example, one of the issues raised here is that our CALD community members have different perceptions of government agencies as authority figures based on their cultural experiences. We have here a quote from one qualified firefighter in Urban Fire Station, and I think I'm going to give you a few minutes to read quickly through the quote. So this firefighter was able to articulate the importance of how members of CALD communities perceive them in their uniforms. So they're coming from various cultural backgrounds wherein men and women in uniform will perhaps instigate some kind of response. So that's one thing that perhaps also influences or impacts the way that they are being received when they knock on doors. And also there are cultural differences in accepting people inside their homes. So for example, women are reluctant to speak to visitors who are men unless men in their families are around. There are practices such as removing footwear before entering dwelling places that are also causing some ways in terms of how firefighters perhaps can approach knocking or home safety, safety home visits practices. And there are also extended family ties that lead to overcrowding. One of the qualified firefighters we've talked with mentioned that some of those migrants that will be living in dwelling places would be with extended families. So some of them would be reluctant to open the door when they knock because they think that they're going to talk about overcrowding. So what this qualified firefighter was mentioning was that they're not there to actually work on that, but they just want to make sure that they're all safe and that all members in that dwelling place will be aware in terms of how they perhaps can be prepared when there is fire emergency. And also we've learned that communication is more than translation. So translation cannot simply be the conversion of a written message, but rather that this requires more understanding of broader cultural beliefs, practices, norms, needs, and priorities. So here's one quote we're in. We found it quite interesting when it comes to translating. Apparently, most of our communication messages when it comes to emergency and disaster preparedness would be in English, but when we translate them, there are no direct translations of specific words. But very importantly, we realized that when we translate some of these slogans, the rhyme component doesn't make sense anymore. So remember, rhyme is important for us because that aids recall. So when we translate these messages into their local languages, when the rhyme is lost, the recall is quite poor. However, we haven't thought mostly about this because we still think that most of these slogans will be translated in a rhyming way, which doesn't happen. And some of the other taken for granted practices would be, for example, dialing 000 for help. So the lack of awareness of called community members on, number one, when is it appropriate to call 000? What information will be asked of them by the operator? What's the language used? What's the order of questions asked? Or more importantly, if the resource is paid. So we see that when the CALD communities highlighted this in the discussions, we were realizing that once again, we're quite assuming that we know how people should dial 000 and for what purpose and when to do it. But then we realized that there are again gaps in terms of understanding of when this particular resource can be used. So there are quite plenty of issues that we have realized there. What we realize is that we can perhaps look at factors that can lead to cultural competency of emergency and disaster responders. So we're thinking that culturally competent emergency responders can effectively engage with communities. And communities that are engaged can actually lead to resilient communities when it comes to preparing for emergencies and disasters. We call the model CLEAR TLC model, and it's an acronym for principles that perhaps will describe how cultural competency is achieved. Our study argues that number one, you need to have cultural awareness. So cultural awareness talks about not necessarily just language, but once again, the broader cultural norms and beliefs that migrants bring into Australia when they move to this country. So the idea here is that it's not necessarily monolithic. CALD communities are not monolithic and homogeneous. Once languages differ, cultural practices differ, and once again, their experiences differ. Lived experience talks about the importance of appreciation of the different experiences of CALD communities, such as migrants, children of migrants, and even refugees. A person who has perhaps just arrived in Australia will have different experiences with authorities, especially if they're coming from war-torn or conflicted countries, compared to migrants who have been here for 10 years already. So their level of perception and appreciation of fire safety and emergency safety messages might quite differ. Engagement talks about the importance of fire responders or emergency responders to be visible with their communities so that they are trusted and they are able to integrate more with the different kinds of social engagements that are quite important there. Accessibility is important to cultural competence because this talks about the importance of translated materials, how readable they are, how people are able to relate to the visuals, the colors, and even the other cultural symbols that we use when we're trying to package information about fire safety, emergency preparedness, and even disaster preparedness. Relationships are also important because we view that cultural competency should be ongoing. It's not a one-off kind of transaction wherein when you knock on a door, your kind of work is done. It's actually trying to know that community members should know that ongoing relationships with emergency responders are quite important so that they can work together in terms of how they can be more resilient. Now, the other part of our model talks about how these principles can be actually related to or translated to certain protocols. So we understand that these principles should be embedded in training packages. Training packages should understand how to localize content. And very importantly, how do you bring this to your communities to be able to connect? And more importantly, we've realized that the way that you look at training, localizing, and connecting should be looked at different levels as well within organizations. We understand that the organizational culture should be able to facilitate this kind of appreciation of diversity of communities. The station managers at the managerial level should be able to monitor, for example, if those people rostered, the firefighters rostered within a particular station, have the competencies and the cultural awareness training that they can use when they are engaging with community members. And at the bottom would be the operational level, wherein you're talking about the actual ability or capability of firefighters to be able to translate the training needs, the training learnings into the actual practice or into the actual way that they're engaging with their communities. So the clear TLC model is basically trying to say that if we want to be able to develop culturally competent responders, it has to start, or it has to be viewed holistically by the organization. It has to start from the decision makers all the way to the frontliners. Now I pass it on to Natalie to talk about our co-designing of our smartphone app. Thank you.
Great, thanks, Kate. So one thing we know already is that very few people, surprisingly, are not carrying around an A4 home fire safety booklet. They're not really doing that, but they do have a smartphone in their pocket, which is very helpful. So we've developed a mobile app prototype, which is called Ready, Set, Go. And it's a prevention, preparedness, and response app that will gamify the process of preparing the family and home for potential emergencies. So we hope to harness the power and familiarity and convenience of technology to find new ways to communicate across cultural boundaries and to engage users with messaging that could protect them and those that they love most from preventable emergencies. So for instance, the app will have sort of games to encourage families to practice response actions, such as a home fire escape plan. It will have push notification functionality that will allow them to receive notifications to test or replace their smoke fire alarms. There'll be seasonal reminders to do things like a winter fire safety checklist, or now as we're moving into the warmer months, something like a spring or summer barbecue checklist. And things like location and hazard specific information. So by making it personalized to where someone is in their area, they might receive bushfire content if they live, for instance, in the Blue Mountains, or flood preparedness content if they live in the Northern Rivers. So the content will be multimodal, it'll be largely video and image based, and of course, more easily updated than a brochure. So as changes occur or new information arises, that can be pushed into the app and made available to everybody straight away. So things like the upcoming information around lithium-ion batteries, for instance, that information as it progresses can be updated very easily. So in the next slide, Kate, we're going to show a little bit about the kind of a process that we took on. So as Barbara used, we kind of followed a co-design approach as well. And we used very specific app design user testing methods where we engaged our cold community members in that research process from the beginning. So we conducted user testing across 3 sessions over 3 months. So between July and September this year with our community groups to test that kind of key messaging and language that was used in the app, how the information or content was structured within the app, and then the usability and functionality of the prototype itself. So by doing that, we learned from our community members from the start. We engaged them to learn about their needs and gather key insights, to ideate with them and find out, their ideas for how we could design the app and what things could work better. And then lastly, to validate. So, test and evaluate whether that prototype that we've developed is actually working. So we used some different methods that I'm only going to talk about 2 today. So one of them was a card sorting activity. And so this is one activity where we take some of the key content areas or topics that would be available within the app, and we ask our community members to group and sort them into meaningful categories. And from that, we're then able to structure the application in a way that hopefully makes sense to as many people as possible. Obviously, we can't organize it to meet everybody's individual concept models that they have in their brains, but we can go with the one that's most common and most used. And also to look at how things were labeled and what they were called. And then on the next screen, we'll show some community members participating in some other key activities that included testing the feasibility and functionality and usability of the app. So here you can see participants viewing the prototype, In the first session, they viewed it on the laptop, and in the recent session, they actually opened it up on their phones and had a look at the app prototype on their own smartphones. So here you can see them looking at the screens. They're running through key activities and tasks that would be normally performed within the day-to-day use of the app, for us to see whether or not they're doing it in a way that we anticipate, and to get feedback on things, again, like the structuring of the content, what we're calling things, and are they locating information in a way that's that we anticipated, and are they understanding the information when they do get to it. So the next screen has a few screenshots from the app as it stands now. It's obviously still in progress, so there'll be updates along the way. But on the left here, you can see the welcome screen, and on the right is our main home screen. And on the next slide, you'll see that we have three main content screens. One is about learning. So here we anticipate is where users will go to learn information about fire safety and preparedness. In the practice part of the app, this is where they get to practice the different skills and knowledge that they've learnt. And in the act section is where they get to practice and learn about what in the case of an emergency actually happening, what can they do? So they can learn about what happens when you call 000. There's a game part there where they get to actually practice that. And then if they need to, they can book a safety visit for a firefighter to come to their home and help them. And in the last screen that I'm going to talk about, as it hopefully plays a little bit of a prototype in action, we went through an extensive kind of onboarding process with this. I think you might need to press play there, Kate. Yeah. Oh, just go back one and just click the screen. Hopefully that'll work. If it doesn't, that's fine. So with this particular with app, we wanted the onboarding process of that to be really meaningful. So here we're able to capture information from the users about who lives in their home, where they live, the type of home that they live in, whether it's single story or in a high rise or an apartment building. And then the information would be tailored to that experience of that person. So it becomes more personalized and meaningful. So some of the key findings we found during this user testing process was that the visual content, such as icons and graphics, were used mainly to navigate through the app. So they weren't really reading the content or the labels of content. They were looking at the icons and going with whatever icon they thought meant that particular information. And that the language that we had taken from the Fire and Rescue New South Wales website and the documents, such as fact sheets, required much more sort of simplification in the app. So we wanted to retain important words such as hazard, sensors, because these are words that would be used in kind of broader conversations around safety messaging. So we implemented a dictionary function where those words are highlighted and they can be added to a dictionary where further translation and description of that can happen. So video content was able to be understood a lot more in terms of key safety messages than even icons and text. So video content is going to be a big thing going forward. And then lastly, participants really liked the idea of the game element. So this was something that we anticipated or we had hoped for. And then when we tested that with them, they were really pleased to see it and really enjoyed doing it and learnt from those experiences. So things like practicing calling 000. One participant said that would make it a lot easier for them to do that in the event of an emergency. They would know what to do and feel less scared about it. And then the game of keep looking when cooking allowed them to, practice, some of those things before the emergency arose. So I'll pass it over to Kate again to wrap us up because I know we've got about a minute to go.
Actually, Min will be wrapping us up.
Sorry, Min.
Thank you.
Thanks so much. So I guess, we have about 30 seconds, but obviously, our hope is to practically apply this in our environment. So at Fire and Rescue, this information will be used as the basis to develop a new culturally and linguistically diverse communication toolkit. It'll include how-to videos on how to deliver a cross-cultural presentation, some awareness videos on why this is important and how this is encompassed in our role as firefighters, and some next steps that people can take to develop and enhance their own knowledge. And obviously we'll continue to add to that, and we're collaborating across a number of agencies, so New South Wales SES, RFS, Fire and Rescue Victoria, to continue to take feedback as we go, and hopefully to share that information Obviously, the ultimate goal is for us to recognise that we have a rich and diverse societal fabric, and that we have, as such, we have an ongoing responsibility to bridge that gap between the values and norms of our community members on the one hand, and the necessary messaging of government agencies around safety on the other. And obviously for us, we believe that that may just go a long way to bridging that gap between the 55 preventable fire fatalities that happen in Australia every year, and hopefully a safer future for all Australians.
Thank you very much to all our presenters. We don't have anything in the Q&A, but we have had some lovely chat, and we all know that we're out of time. I think that the timeline is fairly strict with the Rescom, but I think maybe it's a case of we're fresh. That is your audience, and it's such it's an engagement at the level of awareness. So lots of I'm looking for the right words here. Jaw dropping, for want of, probably not the best choice of words, but you know what I mean. I think it's just a wealth of information. Two really good presentations. I'm so conscious of time myself. I'm rushing a bit, but I would say you folks, now a recording of this will come up in due course, so you don't forget that. And to our audience today too, and people, so spread the word so people who could not get here can also get the benefits of the presentations that we've had. You folks can learn a lot from each other. I can tell that through the chat, and no doubt there will be continuing conversation between you all. My last or finishing words would be, and I've had to be selective with time, but the pedagogical learning design elements that really jumped out at me, amongst other things as well, but that's the one I'll mention. And so obviously the gamification, using apps, the learning design with testing built in. And Barb, in yours, I really like that novel and really smart idea that people are learning in transit while they're being transported to a place, and that just on time learning, because it means the information's fresh too when they hit the ground. And so I think that there's just a whole bunch of other fabulous ideas in there, and another one, I'll make this my last, but I thought using the responding to events and emergencies, using that time to engage and communicate is it's really smart. It's a good idea. So I thank you all, and for a great
so can I make a quick announcement for PRIA members? So next month we are going to have the Rescom webinar we call Project Month. So we are going to have two panel teams again, and then one from industry team and the other from academic. So one industry team is actually talking about trans attachment women leader study tour called Innovation, Sustainability, and the Voice to Parliament. So we invited those female leaders actually related to the Voice campaign. The other panel is from RMIT, Shima Shane, and then she's going to share her analysis of corporate social advocacy by Australian universities around the Aboriginal and Torres Strait Islander voice. So both are actually about voice, and it could be very interesting around, now we are actually expecting the election soon. So it's going to be very interesting webinar next month. So, and we keep look for our announcement, and then register for the event. But Chris, you're mute. Yeah, Chris, still you are mute, but I guess.
Oh dear, I'm sorry about that. I'm just thank you for promoting the next event, because it's really important, and I've looked at. So I think, Maddie, well, if you've got have you got anything else to say, Sujin?
Now, thing is, for the presenters today, so in general, PRIA Rescom, so it's going to be shared over our YouTube channel and also our own the blog website. So, but it takes probably a couple of weeks, and then but anyway, so in that way, actually, we can share your important research presentation today, but that is going to be shared with the broader community in a few weeks. Thank you, everyone, for today's interesting presentation.
Thank
Thank you, everyone. Bye.
Thank you, everyone.